A patient with a suspicious or worrisome lesion would need a fast-track referral to be seen by one of our consultant dermatologists or skin cancer nurse specialists. We would be expected to see the patient in a clinic appointment within 2 weeks of their GP's referral. In Gemma's case, she will have checked in at the dermatology reception and then be called by a healthcare assistant into Dr. Forgey's clinic. Dr. Forgey wasn't available to participate in this filming, so clinical nurse specialist Joan De Vega agreed to stand in. Under normal circumstances, a new patient would be seen by the lead skin cancer nurse Heather Baines or one of the consultant dermatologists. In accordance with the cancer pathway, we then needed to sort an appointment out for the operation as soon as possible and within 2 weeks. The healthcare assistant working with Dr. Forgey will then have spoken to our appointments clerk to arrange this appointment. If possible, the patient leaves that day with an appointment, time and date. If not, they are generally phoned within the next day or two to confirm attendance. Gemma attended her appointment for her excision and was clerked in by the receptionist. She will then have been called for by the surgical nurse who was supporting the surgeon. Gemma's consent will have been taken prior to the procedure, support offered throughout and aftercare instructions before she left. Results generally take 7 to 10 days. Anyone who needs further treatment for a confirmed skin cancer are brought back into hospital to see a consultant or a clinical nurse specialist. Anyone who does not have a skin cancer or does not require any further intervention will receive a letter explaining that from their consultant. Once results come back from the pathology lab, they are discussed at our weekly multidisciplinary team meeting and a plan is put into place for the patient's journey. Following the meeting, the patient is contacted by a member of the admin team where they are asked to come to another clinic appointment. Every patient is treated as an individual and every diagnosis of melanoma or any skin cancer is very individual and very different with each person. Follow-up appointments depend on the diagnosis and the timescales vary quite a bit depending on how much support the patient needs and how often we need to check according to guidelines. When they come back to any of the follow-ups, they have the opportunity to ask us any questions they might have about the diagnosis or about their ongoing journey. They also are given regular sun safety advice and updates. They have a skin check, a full skin check at every follow-up appointment, and also the lymph nodes are checked. This is usual procedure and all patients that have a diagnosis of a skin cancer are given this treatment.
Well, that wasn't as bad as I thought it was going to be. Clifton Hospital it's a lovely environment and staff are wonderful. I was really stressed before I came, I was so nervous, but it actually wasn't as bad as I thought, and like I said, everyone's fantastic, so not so bad.